Hello, and welcome to our webinar on how to access adult sexual assault services in the District of Columbia. If your patient has disclosed they have been sexually assaulted at any point in their hospital visit, these are the steps you should take to access the appropriate forensic nurse and advocacy services. We know that as healthcare workers, you have limited time. So today, we will review the three most important parts: the patient's legal rights, an overview of SANE services, and how to access these services specifically for emergency department patients, hospital admitted patients, and outpatient patients. First, let's review the legal right to advocacy in SANE. Any patient who discloses sexual assault in the hospital setting and is at least 13 years old is entitled to a specially trained and confidential sexual assault advocate. This legal right stems from the Sexual Assault Victim Rights Amendment Act of 2019, also known as SAVRA. The law specifies that patients must be notified both verbally and in written format of their rights. The right to a SAVRA-trained advocate attaches at any point a patient discloses while at the hospital, in both inpatient and outpatient settings. It is important to note that only SAVRA-trained advocates meet this legal requirement. Hospital-based advocates, case managers, and other community advocates do not meet the legal requirement. Lastly, the only way to access a SAVRA-trained advocate is by calling the DC Victim Hotline at 844-443-5732. Under SAVRA, when a patient discloses sexual assault, the hospital is also required to notify patients of their options regarding SANE services. It's illegal to bill a patient for their SANE exam or sexual assault kit. It's also illegal to force a patient to cooperate with police in order to get the exam. If a patient declines a forensic exam by DC law, the hospital must offer all medications that the patient will be eligible for, including emergency contraception. Now, let's review SANE services in DC. The medical forensic exam, or SANE exam, can include as much or as little as the patient wishes. Forensic nurses are trained to take a detailed history of what happened. They complete a thorough assessment that includes specialty areas of focus, such as strangulation assessments. The forensic nurse can document injuries and findings on a body diagram, as well as through photography. They are trained to use specialized equipment like an alternate light source to look for injuries, bruising, or fluids. They may collect a sexual assault kit, which in DC is known as a perk. Many people refer to this as the rape kit. In addition, the SANE exam may include toxicology testing above and beyond what is offered in the hospital setting. Lastly, the patient may receive any medical recommendations, such as CT scans or medications, and any type of follow-up care referrals. DCFNE is the only provider of SANE services for adults in the district. Most of our exams take place at MedStar Washington Hospital Center, but we are able to dispatch a nurse to other hospitals under certain circumstances. It is recommended that if a patient wants a sexual assault kit or evidence collected, they should have their exam within 5 days of the assault. However, we can still perform an exam and documentation up to 30 days post-assault. Because these legal rights begin at age 13, it's important to note that if an adolescent is in need of SANE services, a youth sexual assault advocate can be accessed via the DC Victim Hotline, who can further help you figure out their options. Now, let's review accessing advocacy and SANE services for emergency department patients, hospital admitted patients, and outpatient patients. Here are the steps to access advocacy and SANE services for emergency department patients that are stable for transfer. First, call the DC Victim Hotline to dispatch an advocate. Next, call the MedStar Transfer Center to arrange an EMTALA-compliant hospital-to-hospital transfer. All patients who are physically and mentally stable should be transferred to MedStar for a SANE exam. This must be an EMTALA-compliant transfer. DCFNE will perform the exam at MedStar when the patient arrives. The patient does not need to be transported by ambulance. The advocate can coordinate transport via Uber at no expense to the patient. All patients who have experienced sexual assault will be accepted by MedStar's ER despite any EMS alerts or bypass. An example phone call to MedStar Transfer Center can sound like, "I'm Dr. Blank calling from Blank Hospital. I have a patient who has been sexually assaulted. I need to transfer them to MedStar's ER. Can you help with that?" An example phone call to the DC Victim Hotline can sound like, "Hello, my name is Dr. Blank with Blank Hospital, and I have a patient who states they have been sexually assaulted. It's my understanding they have a legal right to a SAVR-trained advocate. We're in the process of transferring this patient to MedStar to be seen by a SANE nurse. Can you please dispatch an advocate?" When calling the DC Victim Hotline and MedStar Transfer Center, provide the following information: hospital name, patient's name, date of birth, patient's phone number, unit, physician and RN name. Here are the steps to access advocacy and SANE services for emergency department patients that are unstable for transfer. First, call the DC Victim Hotline to dispatch an advocate. If the patient is not physically or mentally stable for transfer, you must still call the DC Victim Hotline and request an advocate be dispatched. Provide the information listed here, such as the hospital name, patient's name, date of birth, patient's phone number, unit, and physician and RN name. Then, once again, call the MedStar Transfer Center and tell them you need an off-site exam and request to speak with a DCFNE forensic nurse to coordinate. DCFNE will perform the off-site exam at your facility. Now, let's review the procedures for accessing advocacy and SANE services for hospital-admitted patients. These steps are similar to the steps you would take when accessing advocacy and SANE services for unstable emergency department patients. First, call the DC Victim Hotline to dispatch an advocate. If the patient is admitted to the hospital but requires a SANE exam, you must still call the DC Victim Hotline and request an advocate be dispatched. Provide the information listed here. Then, once again, call the MedStar Transfer Center and tell them you need an off-site exam and request to speak with the DCFNE forensic nurse to coordinate. DCFNE will perform the off-site exam at your facility. Lastly, let's review the procedures for accessing advocacy and SANE services for outpatient patients. First, call the DC Victim Hotline to dispatch an advocate. Although there is no official transfer policy when sending a patient from an outpatient setting, it is strongly encouraged for the provider to call the MedStar Transfer Center to complete a pre-arrival note. DCFNE will perform the exam at MedStar when the patient arrives. In some cases, a patient may not know if they want a SANE exam done. In these situations, it's always okay to dispatch an advocate. If the advocate gets to the hospital and the patient doesn't want to see them, it's not a wasted trip. Advocates are happy to go out and try to speak with the patient. If you as a clinician are unsure if a patient should receive a SANE exam or if you have any questions, call the MedStar Transfer Center and request to be connected to a forensic nurse. Forensic nurses are also happy to speak with the patient by phone. There are many ways one can access DCFNE services. The first being to walk into MedStar's ED, where services can be accessed 24/7, 365 days a year. Next, you or the patient can call the DC Victim Hotline 24/7, where free Uber rides can be arranged for the patient if needed. Next, you or the patient can call MPD. Lastly, the patient can walk into any DC hospital where the patient will be transferred to MedStar if stable. If the patient is unstable, an advocate and forensic nurse will be dispatched to the hospital they are in. Just to recap, this webinar reviewed the legal rights of a patient, reviewed SANE Services in DC, and how to access SANE Services for emergency department patients, hospital admitted patients, and outpatient patients. Remember to call the DC Victim Hotline to dispatch or speak with an advocate, and call the MedStar Transfer Center to arrange a transfer or to speak with a DCFNE forensic nurse. If you have any questions regarding the content of this webinar, or if you would like us to address anything that is non-urgent, please feel free to email us at contact@dcfne.org or call 202-742-1736. Thank you.